video on inhalers. Firstly, we're going to be talking through the pressure metered dose inhaler, which is this commonly used puffer. So the best way to get the medication into your lungs is to use something we call a spacer or an aero chamber. Some of them, they all look a bit different, but the technique with the aero chamber is the same, whether it's a face mask mouthpiece or just a simple mouthpiece. So first of all, I'll demonstrate with the simple mouthpiece. So first of all, you need to give your inhaler a shake, pop it in the end of the spacer, and we do one puff at a time. So once the medication is inside the spacer, it's not going to go anywhere until you breathe it in. So one puff. So you can do it away from your face. Quite often people put it to their face and try to press down, and it's a bit tricky to do that, so you can do it away from your face. And you're going to do 4 to 5 gentle breaths in and out, so just normal breathing. And that will be enough to get the medication into your lungs. If you hear a whistle with the spacer, you're doing it too hard, too forceful. So if you hear this, then a lot of the medication is just going to get stuck in the back of your throat because you're doing it too forcefully. So for the second puff, you need to wait about 30 seconds before you do your next puff. So give it another shake. And again, puff into the spacer and 4 to 5 gentle breaths again. Another common mistake is people think you can't breathe back out into the chamber, but you can because there's a valve which makes sure that your breath out goes elsewhere and not back into the chamber. So sometimes I've seen people, but you don't need to do that either. The face mask, so that's the technique with that spacer. This one's exactly the same, so you'd give it a shake, pop it in the end, but you can breathe in and out through the mask, so make sure you've got a good seal over your nose and mouth. And again, it will squeak if you breathe in too deeply. Just the same. It's a good idea to rinse your mouth out after you've used your inhalers, but it's particularly important after you've used a steroid inhaler. So after every time you've used your steroid inhaler, make sure you rinse your mouth out with water. So now Donna will be demonstrating the RespiMat device. Now the RespiMat device is a soft mist, so you don't need to do a strong or fast inhalation. It needs to be quite gentle. So first of all, we'll just show you how the device works without putting it in our mouth so you can see the mist. So to prime the inhaler, to do the first dose, you need to twist 180 degrees and you'll hear that click. Then remove the lid. Now at this point you'd get ready and put it to your mouth, but Donna's not going to. Donna's just going to press, and I don't know if you'll be able to see, but you can see a bit of a fine mist there. So that's what you're going to be guiding into your lungs. So this is why we need a gentle inhalation, because if you do a too strong a breath in, a lot of it will get stuck at the back of your throat. So we'll prime the inhaler. So if you could turn it 180 degrees, Donna. Then we'll take the lid off. Now it's a bit fiddly, so the best thing to do is to get your finger ready on the button, and then we need to make sure that you are prepared for the inhaler. So just breathe normally, do a nice breath out, so you're ready, and then to your mouth, press, and you do a full but gentle breath in. So it's a nice full breath, but gently guiding it into your lungs. And with the Spiriva or the Spiolta RespiMat, there's 2 different RespiMat devices. They've just got different bronchodilators in there, different medications. It's 2 puffs, so you'd then replace the lid, turn again, and again it's best to wait 30 seconds between each dose. And then when you're ready, remove the lid and make sure you're prepared, so breath out. And you press the button once you're ready to breathe in and hold. That's important to hold your breath for up to 10 seconds if you can, or for as long as you can afterwards. So So now we're going to be talking through dry powder inhalers. There's lots of different dry powder inhalers, this is just a few. The technique is always strong and deep inhalation, because the way the dry powder inhaler works is the medication is in a powder form, so you need to do a strong inhalation to break up the powder to then get it into your lungs. They all look a bit different. Some of them you have to put a capsule in, like the Ultibro. So you'd put a capsule in there and then close it, press down to break the capsule up, and then a strong and fast inhalation. So I'll show you what I mean by that. So and hold. So it's a very different technique to the one we were using with the spacer, where you're trying to be gentle and just guide it into the lungs. The handinhaler is similar in the way that you put the capsule in. So they're all a bit different in the way that you prime them, but the technique is the same, strong and deep or strong and fast. So this one again, you put the capsule in, press the button, which puts a hole in the capsule, and then and hold. So you're doing a full, strong and deep breath in. Now some of them prime themselves, so this is an elliptor. You hear a click and then you'd do the same. We can't go through all of them because there's just so many, but we just thought we'd give a bit of a variety. This is similar, so you'd hear a click and then you'd know that the medication's ready, and it's a strong, fast inhalation.
Now I'm going to talk through how to clean out your air chamber. This should be done once a week. You can remove the rubbery end off, rinse it out with hot soapy water, and then rinse afterwards. Do not dry inside, just leave it on the draining board to drip dry, and then put it back together again.